Awesome. Okay. So our next speaker, up next, we have Dr. Alicia Franklin from the Silent Spring Institute. She's going to dive into examining personal care products among women of color. Dr. Franklin will help us to explore breast cancer relevant chemicals in everyday products. She's here to share some of the eye-opening research that takes a closer look at Black women's exposure risk from the products we regularly use. Welcome, Dr. Franklin.
Thank you so much for having me. I just want to start off by saying, oh my goodness, this is such a great event, and I'm so grateful to be a part of it. I'm just sitting here learning, and just this is really activating and reigniting my drive and my desire to be a part of this community and sharing, continue sharing my work and continue this work. So thank you to Day and the Bench to community for inviting me and having me here. And wow, just wow. So that said, I'm gonna start off my talk just sharing a little bit about me, my journey to where I'm at now. And so just to kind of give you an idea, I'm from the South Side of Chicago. I'm just a girl who really enjoyed science growing up, and I'd say my mom really nurtured that part of me. And so when it was time to go away to college, went away, studied chemistry, continued on to get a PhD in chemistry. And while I was working on my dissertation, as if that wasn't enough, as if that wasn't enough, I started a podcast, and the podcast is dedicated to highlighting Black women researchers and also highlighting research related to Black women's health and well-being. And so it was during that time where I was looking for topics related to my podcast, and I ran across this talk. That I'm sorry. And I ran across this talk or this paper that was by the Silent Spring Institute. And it was the first paper to look at do product testing for the chemicals, specifically endocrine disrupting chemicals, which we've been learning about today, and asthma associated chemicals. It was the first to look at those in the products that are used by Black women. And so I remember reading this paper and being at the time, I was an analytical chemist studying lipids and their structures, and thinking to myself, I don't know anything about this field of environmental research, environmental health research, but I want to be over there. And so just full circle, I kind of sent a cold resume over to Silent Spring and said, hey, I want to do what y'all are doing. And just again, full circle, I am now working at Silent Spring as a postdoctoral research associate, where I am actually evaluating chemical exposure, specifically those Black women. And so I'm again grateful for the opportunity, and just this symposium is just really encouraging me to just keep going. So thank you all again. I really am at all. And so I just will go into now a few talking overview of a few of my projects. So today I'll just be sharing two projects that I'm working on. And the way I kind of look at these projects, there's one that tries to better understand what the problem is. We've been talking about it, differences in product uses, and then also exposure disparities and things like that. And that is the Taking Stock project. I'll talk more about that. And then I'll go into discussing a project that addresses the problem, and that's the Power or Product Options in Women Engaged Research project. And so just to start off again, one project where we've tried to better understand the project. It's the Taking Stock Project, which is a community research project. And it has multiple tiers. We had gotten so much data from this project, and so some of the different layers. So for one part of it, we did a survey analysis. So we surveyed over 600 women, and with that, we wanted to understand the types of products people were using and if there were any differences in the type. We know that there's a difference between using lotion and then insert that brand type of lotion. And so again, for that survey, it was just about understanding what types of products folks are using. So to dive deeper into what were the brands or the actual exposures that folks in South LA were being exposed, were using, or they're exposed to, we recruited 35 Black women and 35 Latinas so that we could understand exactly what they're using, what are the chemicals that are labeled on their products. And I'm only going to focus today on the data from those 35 Black women. But again, that part of this study was really about diving into understanding the exact, some of the exposures that Black women were encountering. And so again, back to the survey results. So we've been talking about this throughout this symposium. Product use varies by race, ethnicity, and we were another study that found these differences. So in our work, we found that women reported using an average of 8 products a day, with some using all the way up to 30 products daily. And so we asked women about 54 different products, and of those 54 products, we saw differences in use for 28 of those, and they vary by race, ethnicity, with the largest differences being between Black and white women. We also found that Black women reported using higher numbers of not only hair products, which we've talked about a lot, but also more menstrual and intimate care products. And I'll talk about that on the next slide too. And so something else, we found the Hispanic, Latinas, and Asian women reported use of more cosmetics than Black and white women. And also that 70% of the women in our study preferred scented versions of products over their unscented counterparts. And again, Dede mentioned this earlier, which is that fragrance itself is just a general term. It doesn't give you an idea of exactly what is in the product. And so a lot of times, when you see fragrance on the product, most times it's an umbrella term, and then it can account for hundreds of chemicals or dozens of mixtures. And so we spoke a lot about how product use varies by race, ethnicity. Again, we found it, but interestingly too, is that we wanted to evaluate and examine menstrual and intimate care product use. And what we found was that education was a stronger predictor for product use than race, ethnicity. And this is really interesting, and we leveraged this in I'm going to talk about the project, the addressing the problem. And we leverage that in understanding that with more education, folks are more empowered to make changes in their product use. So what our study found when we used the responses from the Taking Stock study, along with another study, the Forge study, was that folks with less formal education folks with a less formal education were more likely to use scent altering products. And those are the douches, sprays, powders, and wipes, along with scented menstrual products. And Black participants were less likely to use scented menstrual cups and unscented tampons, and more likely to use douches and wipes than other groups. And so those are the findings of the survey elements of that study. And I'm going to now transition over to where we really wanted to go and understand what products women were using specifically. And so we had folks log all of the products that they were using for about 5 to 7 days. And the 35 Black women logged over 700 products over that week span. And they logged products from pest control products to air freshener, and there was just a wide variety of products that were logged. And an average of 11 products were used daily during that time period. Now, from there, what we wanted to do is better understand what were in the products. So again, they logged their products into an app. So we were able to get the brands that they were using alongside with those ingredients lists. And so this is an example of one of the lotions that one of our participants were using. And we looked at the ingredients for all products, but I'll walk you through this example, a lotion that from one of the participants' product log. And so some things that kind of stood out, like we wanted to understand what were some of those chemicals of health concern that were in these products. And so you shouldn't need a degree in chemistry in order to read these things, and I have two, and I still struggle with really understanding what's going on a lot of the time. So in this case, you can see here there are 4 different preservatives in this one product, right? So this 𝘂𝑚𝑒𝑡𝑎𝑙𝑙-urea, this product is a formaldehyde releaser. Now, we've been talking a lot about breast cancer related chemicals, and formaldehyde releases aren't technically breast cancer related, but formaldehyde itself is a known carcinogen. And so if you have something called a formaldehyde releaser, you can only assume, based on the name, that that is exactly what it's doing. It's releasing formaldehyde into the product as a form of preserving it, antimicrobial properties. And we've talked about parabens. Dr. Tapia also mentioned about parabens earlier. This one has 2 different parabens on this one label. And then there's BHT as well, which is an immunotoxicant. And also there are these fragrances. And so again, the umbrella term fragrance, but not only that, they also list out all of these different fragrances on top of that. So you're looking here at multiple listed out fragrances, plus this umbrella term fragrance. We don't know how many fragrances is in this one product. And so this is a general term again, and it may contain some hormone disruptors. And then some of these listed out fragrant chemicals are breast cancer relevant, a breast cancer relevant chemical. And what do I mean by that? So Silent Spring, we came up with this list of over 900 chemicals that we found to be breast cancer relevant. And so there are a lot of different ways that you can try to evaluate whether a chemical is safe or unsafe. There's all these lists. If you live in California, you're probably used to the Prop 65. And so you'll see this label on your product saying, hey, it has some chemical in it. There's lists to say something is a carcinogen. There's lists to tell you if things are reproductive toxicants. What we did was we wanted to see how many what we did is compare the ingredients that were on the products that the participants use to our breast cancer relevant chemical list. And what we found was that when it comes to the products that the participants logged, they for all categories, there were less than 3% of the overall products contained at least one breast cancer relevant chemical. Now, this may seem like a small number, but 3%, it just seems not that big a deal. But interestingly enough, even though those numbers may seem small, all but one woman had one product with at least one breast cancer relevant chemical in it. And so there's also some commonly used chemicals that we saw on the labels were parabens and formaldehyde releasers. And so most participants were exposed to parabens and also, again, those chemicals that release formaldehyde into the product. And then just some key takeaways. I usually like to end my talks with like some actionable steps, but you should come to day 3 so that you can get some of those actionable steps on how to move forward. But I'll just share some things we found, which is that harmful chemicals are listed on everyday products, and some products contain multiple harmful chemicals in them. And so, for instance, I showed you that label where it had 4 different preservatives, some that were, EDCs. And so we have all this information, right? And now we want to share it with folks and empower people to make changes and things like that. So I want to quickly share with you all one of the ways in which we are sharing some of this knowledge beyond the research science space, and that is through partnering with social media influencers. So we share information about endocrine disrupting chemicals with Black women by partnering with social media influencers. They create content. We make sure it's scientifically sound. They share it with their audience. And so far with this work, we've reached over 100,000 accounts, and we've got some really good engagement with it, like, shares, and comments. And we also found in some survey results that seeing the content was actually correlated with EDC exposure reduction behavior. So again, we want to we not only want to do the science, we want to share the science with the relevant communities. And so there was a wide range of content that was shared. I'll share an example post right after this. So we had folks who posted on LinkedIn, TikTok, Instagram. And so an example post was Dr. 𝗥𝗲𝘀𝗲𝗿𝗂𝐴, who shared this beautiful picture of her and her husband in their home. And essentially, this is the aesthetics of her Instagram page. She created this post and then these 3 tips that are just bite-sized, easy to digest for her audience. And it reached a bunch of folks. That being said, if you're interested in learning more about what we found in those survey results, the preprint of this work is available. And so I have the, if you want to scan that here. And that being said, I am here to answer any questions. And thank you again for having me. I'm enjoying it. I can't wait to be back in the audience listening in.
Oh, wow. Wow. This was so exciting, Dr. Franklin. Thank you for sharing, and your passion for wanting to do science, excuse me, is enough to encourage some young folks to become scientists, because clearly we need more African-American scientists in the lab and to be able to bring this information forward. And I know I'm one of those people, I can't wait to get to 3, but we have to pass 2 before we can get to 3. Session 3, where all this information will really, really be laid out for us to be able to click and to go through. Again, thank you for this dynamic information, and we will be covering questions at the end. But I have to tell you that one of the questions I'm gonna have, but we can't answer right now, is since many Black women, including myself, have been using these products for years, what steps can we take to minimize the potential of long-term effect of these exposures on our health? Don't answer that now. We're going to get to that later, but that's one of the good ones. That's one of the good ones. All right.